The role of calcium in bone density. The vitamins and minerals present in all of the food we consume are vital for our organ systems. However, there are some nutrients which affect our bone health. Calcium and vitamin D. You also know that calcium, especially in calcium phosphate and calcium carbonate, is a critical component of the bone. Since the body is unable to generate calcium, it must be absorbed from the diet. Without vitamin D, however, calcium cannot be absorbed from the small intestine. Therefore, vitamin D consumption is also essential for bone health. It also plays a part, but not as well known, in bone remodeling and the role of vitamin D in calcium absorption. Milk and other dairy foods are not the only sources of calcium. This essential mineral is also present in green leafy vegetables, broccoli, and intact salmon and canned sardines with their soft bones. Almonds, beans, peas, and shellfish contain calcium in smaller quantities. Vitamin D is not naturally present in many foods, except for oily fish like salmon and tuna, or fortified milk or cereal. The effect of sunlight on the skin allows the body to develop its vitamin D, but vitamin D is deficient in specific individuals, particularly those with a darker complexion and those living in northern latitudes where the sun's rays are not intense. A physician may recommend a vitamin D supplement in cases of deficiency. Other nutrients. Bone mineralization is also aided by vitamin K and can play a synergistic role with vitamin D in bone formation regulation. Vegetables with green leaves are a decent source of vitamin K. In favor of bone protection, the minerals magnesium and fluoride can also play a part. Although magnesium in the human body is only present in trace quantities, more than 60% of it is in the skeleton, meaning that it plays a role in forming the bone. Fluoride in the bone's hydroxyapatite crystals can displace the hydroxyl group and form fluoroapatite. Fluoroapatite helps preserve and reinforce bone minerals, similar to its effect on dental enamel. Inside hydroxyapatite crystals, fluoride may also penetrate rheums, thereby increasing their mass. In different areas of the body, omega-3 fatty acids have long been known to decrease inflammation. Inflammation may interfere with the osteoblast activity, so the intake of omega-3 fatty acids in the diet or supplements may also improve the development of new osseous tissue. The role of nutrients in bone health is summarized below. Nutrients and bone health. Calcium. It is essential to make calcium phosphate and calcium carbonate, which forms the hydroxyapatite crystals that give bone its hardness. Vitamin D. Required for absorption of calcium. Vitamin K. Supports bone mineralization, may have vitamin D synergistic effect. Magnesium. Bone's structural component. Fluoride. Bone's structural component. Omega-3 fatty acids. Reduces inflammation that can affect osteoblast function. Summary. Vitamins are substances that your body needs to grow and develop normally. Vitamin D helps your body absorb calcium. Calcium is one of the main building blocks of bone. A lack of vitamin D can lead to bone disease such as osteoporosis or rickets. Vitamin D also has a role in your nerve, muscle, and immune systems.